Rosa Lopez is a nurse in Berlin. For 20 years, she's been helping older people who can no longer care for themselves. Rosa is originally from Spain. She loves her job, but it's increasingly difficult to do it well. 36,000 positions for care workers remain unfilled in Germany, and she feels the effects of this personnel shortage every day.
Doch, natürlich. Mit Pflege, ja, aber ich habe die Behandlungspflege. Wir haben zwei
Ist
Schlüssel.
nicht schon mal korrekt, dass sie den Schlüssel genommen hat, ne? Das ist in Ordnung.
Das ist in Ordnung.
Nurse Rosa's work week gets off to a brisk start.
Warst du schon mal da?
She's one of more than 30 caregivers who work for Janke, one of Berlin's oldest privately run home health care services.
Mehr oder weniger.
The office has a house key for each patient, because many can no longer open their own entrance doors.
Schon flink.
Trained nurses like Rosa Lopez care for as many as 30 patients a day.
Ich habe ja vieles in meinem Leben
I've tried a lot of things in my life, but I wasn't so happy with any of them. Then I just started nursing, and that was my thing.
Und das war mein Ding.
Why?
Einfach die Vielfalt.
It's just the diversity of working with people, their different stories. Every day is different.
Her first patient today is Ruth Helmich.
Ich grüße Sie. Na, meine Gute.
Frau Helmich is 94 years old and lives alone. Her husband died years ago. Today, she's in a lot of pain.
I don't have any medication. I don't know what to do.
Have you told your doctor?
No, I don't know what I should do.
Gut, dann rufe ich Sie
Okay,
mal
I'll
an.
call her and see what she says.
But Nurse Rosa can't sit and wait for the doctor to arrive. She can only bill the public health insurance provider for a 20-minute visit, and it's almost over. The nurse tries not to let the stress show.
Okay, erstmal
First the spray.
Ne?
Ruth Helmich can't use the inhaler on her own due to the bad arthritis in her hands. But she wants to keep on living in her own home.
No, I'm not going to leave my nice home. I make my own food, something fresh every day, no canned stuff. I wash the dishes every evening, and I dust.
Das ist ja doof, wenn Sie nur mit einem Schuh laufen.
The daily visit from Nurse Rosa helps her avoid having to go into a nursing home.
So, gehen Sie mal erstmal rein.
And that's the nicest thing of all.
Home care gives 700,000 elderly people in Germany the chance to stay in their own homes. But the healthcare system is overburdened. Personnel are under pressure, something Rosa Lopez feels is only getting worse.
Weil immer mehr alte
Because there are
Leute
more
gehen,
and more
die
people needing help,
gewesen sind,
and fewer who want to do this job.
Menschen, die den Job
Already
machen
they can hardly find people,
wollen. Das ist ja auch
hardly
schon
any
so.
registered
Man kann
nurses.
Kaum Leute kriegen. Kaum examinierte Pflegekräfte.
One reason is because the job is poorly paid. But there's also little recognition for this often tough career.
Ne?
But Otto Mattes is a relatively easy patient. He's content even though his wife is currently away on a trip. He's 81 and today he only needs help putting on his support hose.
What can you expect at 81? At my age, you're already written off by society.
Da sind sie sowieso abgeschrieben gesellschaftlich.
If you didn't have your family, you'd be in a real fix.
Aufgeschmissen, ja.
5 minutes later, the stockings are on. But Rosa needs a bit of time to document her visit in the care file.
Ja, dann schöne 3
I
Tage.
wish you 3 nice days without your wife. If you need anything, you can call me. Bye-bye.
Tschüss, ja?
Rosa walks quickly to her car. As usual, she's double parked because there are no other parking spaces available. That's just one more problem when you have to look after more and more patients in ever shorter amounts of time. Germany's new government has announced that it wants to improve nursing care. Health Minister Jens Spahn has promised to create some 13,000 new jobs for care workers.
If he manages to do that, I'll eat my hat. No, I don't believe it. These people don't exist. He has to train them, and that will take years. No. And first he has to find the people who want to be trained, too.
Guten Morgen, Frau Köller. Ich grüße Sie. Na, haben Sie gut
Good morning. Did you sleep well?
Ja.
Yes, but only from 1:30 to 5:30.
Ja.
Christa Köhler has been waiting for Nurse Rosa. She suffers from bouts of dizziness so severe that she can hardly get out of bed. Frau Köhler was herself once a caregiver in a nursing home. Nurse Rosa gives her some pills. The visit is supposed to last just 7 minutes, but Christa Köhler has a lot of questions. She's received a letter from the district office.
Nicht, zeigen Sie mal.
Show me.
I couldn't believe it.
Die kriegt Leistungen über...
She receives health care services through the district office, and a few weeks ago, there was an assessment. Things are so bad that they're making cuts everywhere, so they're cutting her services. Okay, so I wish you...
Have you seen my grandkids?
Yes, I see them every time I come.
Her daughter has just gotten married,
Zeigen Sie mal.
and Frau Köhler is eager to show Nurse Rosa the wedding photos.
Schön. Hübsche
You have
Enkelkinder.
lovely grandchildren, Frau Köhler. You can be proud.
Können stolz sein.
I couldn't go to the wedding.
Oh,
Oh
Mensch.
no. Did they marry here in Berlin?
No, in Bavaria.
Bayern. Ah, Mensch. Wir sind ihre einzige
We're her only
Kontaktperson.
contact
Wenn wir denn
person,
dahin
so
sind,
when we visit, she wants to talk.
das ist
That's
halt
what
dann
these patients
Patienten, die
need.
auch viel brauchen,
Attention
diese
and conversation.
Zuwendung, viel
They just
reden.
need you to sit next to
Einfach nur
them,
daneben
ask
sitzen,
questions,
fragen,
listen to them, and
hören,
help them.
zuhören und helfen.
That's the best medicine,
Das ist ja eine
better
bessere
than
Medizin
pills.
wie Tabletten geben.
But there's no time.
Die Zeit ist natürlich
Right,
nicht
there's
da.
no time, but you
Ja,
still
aber
try to
man
make
versucht
some.
sie, die
You
trotzdem
can't
zu
just go
nehmen.
in and out and say, who cares what happens after
Also,
I've
wir
gone?
können nicht
I'm here to
einfach
hand
da
out
rein
pills
und
and the rest isn't my
rausgehen und
problem.
sagen, nach mir die Sinnflut.
We're
Ich
not
habe
like
da nur
that.
Tabletten zu stellen, der Rest interessiert mich nicht. Also so sind wir nicht.
Nurse Rosa's already a half hour behind schedule and facing another emergency. Werner Stürzer opens the door, but right away he's sick to his stomach.
Oh je, oh je.
My goodness, did you eat something bad?
Was ist denn jetzt, oder?
Once again, Nurse Rosa must call emergency services.
Ja. Erbrechen.
Vomiting, diarrhea, and slight dizziness.
Ja, ein bisschen Schwindel. Haben Sie schon gefrühstückt?
Did you eat breakfast?
Nurse Rosa wants to make him a tea to drink until the doctor arrives, but she's in for a surprise when she enters the kitchen.
Das ist ja...
Stürzer doesn't yet qualify for any household help, so the place is a mess.
Ah, jetzt. Darauf pochen wir auch dann halt.
The politicians are always so insistent that we act responsibly and not leave people in the lurch. And things keep working out somehow. But at whose expense? The care workers.
So, once again, she stays for 20 minutes instead of 9.
Genau.
Und
Und wir telefonieren.
We'll talk later, and when the doorbell rings, it'll be the doctor.
Ja.
Then she's off again, but once more with a bad feeling about things. Rosa Lopez would love to show the politicians, who have so often promised to make things better, what her typical day is like. Germany's new health minister, for example.
Soll dann bei mir Praktikum
He
machen.
should come and do some work experience with me so we can see right away what things are like.
Praktikum machen
I'd
können.
like to invite him, and not for a day, for a month.
Und dann nicht nur ein Tag. Nee, so ein Monat lang.
You sound frustrated.
Ja. Ist ja auch frustrierend.
It is frustrating when you have more and more patients and less time. The pay isn't right either. Of course that's frustrating. Who wants to do the job? No one. Even if there are nice things about it.
Rosa has known 82-year-old Gisela Schrön and her 90-year-old sister Maria for a while now.
Oh,
You're
heute
on
auch
your side today. Hello.
Hallöchen.
Short hair, you got it cut.
Haare. Ja, Haare ab. Wie geht's Ihnen, Frau Schrön?
How are you, Frau Schrön?
Es geht so.
So everything's okay?
The two sisters moved in together 3 years ago to help one another. Since she had an accident, Gisela, a former lawyer, has been bedridden.
Okay, und jetzt schon ein bisschen zur Seite drehen? Okay.
I was never one to run to the doctor. I had a family physician, but nothing else.
Rosa Lopez changes her bandages and her catheter. A caregiver visits the sisters 4 times a day.
I can't do this alone. I couldn't do it anymore. Because I'm disabled too, and I can only get around with a rolling walker.
The sisters want to live together for as long as possible. They've promised one another that.
Weiß ich ja. Tschüss, tschüss, meine Gute.
Bye-bye, my dear.
All the best, and thank you.
Ja, bitte, bitte,
Once
ne?
again, Nurse Rosa will do overtime to provide her patients care with dignity in their old age. There are still 12 more patients on her list, and she'll press on, doing her best to balance their needs with the realities of a nurse's schedule.